So one of the questions about trigeminal neuralgia is, what are the pain triggers? So usually people have their pain triggered by light touch in the area of the trigeminal nerve. So contact with the face, the forehead, the cheek, the jaws, things like talking, brushing your teeth, shaving, a light wind on the face. Any of these are often common triggers of the pain of trigeminal neuralgia. Question about what are the common side effects of trigeminal neuralgia medicine treatments. So these medicines are usually anti-seizure medicines like carbamazepine, oxcarbazepine, gabapentin, pregabalin. The main side effect is they can make you somewhat tired, forgetful, unsteady, and I would say it's more of an issue as people get older. So a younger person might be on a very high dose of these medicines and not have much side effects at all, whereas an older person may find even at low doses they're becoming forgetful or unsteady. But each person is individual, and one has to consider the effects on each person as an individual. Question, if you're treated with medicines for trigeminal neuralgia, how long do the symptoms improve and to what extent do they improve? So everyone is different. Some people have complete relief of the symptoms and are managed just on medicines alone. Sometimes the disease gets better on its own and just goes away one day for 10 years. In some cases, people do not have good control despite one or multiple medicines, even at high doses, or they have bad side effects, in which case a procedure can be considered. Question, what are the major differences between trigeminal neuralgia and dental disease? So dental disease is much more common than trigeminal neuralgia, and people who have teeth problems, it's more likely that the problems are constant, they're achy, it's worse when they're biting down on that tooth, it's more sensitive to things like cold or spicy foods or hot things, or but again, that's one type of pain. The trigeminal neuralgia pain, usually people have no pain in the face, and then with a light trigger like talking, chewing, a light wind, they suddenly experience an excruciating electric shock of pain that radiates often up the face or towards the ear and then goes away, and then they're fine again. So these are quite different. Obviously, a dentist can look inside your mouth and tell you if you have dental disease, or you can get x-rays, but the nature of the pain is often quite different.